Hello, I'm Dr. James Metz, and I have a dental practice here in Columbus, Ohio, and I teach sleep apnea to dentists. And you might find that unusual, but dentists can do a lot to treat sleep apnea and sleep disordered breathing, as we say. I've been asked by the dentists that come to my courses to explain what I call my flip chart, which I say sleep apnea explained, or the flip chart for sleep disordered breathing. This is what I use to communicate with patients, so I'm going to do that with you today. First, on the cover of it, you'll see that there's a flame, just a candle. You think, what would he want a candle in there for? What it is the body has reflexes. You stick your finger into a candle flame and you jerk it back. You didn't have to think, oh, I'm going to pull my finger out because it's burning. You pulled back before you even knew anything was happening. It didn't even recognize in your brain that there was a problem. Your subconscious or your primitive brain protected your finger from being burned. Well, that's what happens with sleep apnea, and that's what causes the problems. It's a basic primal reflex which is in our bodies. It saves us and it hurts us. So let me talk to you about this idea of the reflex in sleep disordered breathing. I use the term sleep-related breathing disorders or sleep disordered breathing. Those are very big terms, and they encompass sleep apnea, of course, which is what we talk about a lot. But it also has upper airway resistance syndrome as part of it. This is where the patient's oxygen does not drop, but their heart rate increases fairly dramatically overnight. I don't mean getting very high, I mean going up and down, up and down, up and down, up and down, like a yo-yo. And I'll show you what that looks like here in a second. But what that does is it gives the patient the same symptoms, nearly the same I should say, as sleep apnea. They'll have trouble with being tired during the day. They'll have trouble with waking at night. They'll have trouble, of course, with snoring sometimes, but not all sleep apneics snore, and not all upper airway resistance patients snore either. They can have trouble with blood pressure. They can have trouble with type 2 diabetes. They can have trouble with a lot of things that seem to go together with sleep disordered breathing. So let me show you what a patient like that looks like. Here is the patient that I'm talking about with the heart rate going up and down, up and down, up and down, up and down, like that. But before we talk about that, let me show you what normal looks like. Here's the normal. You can see the oxygen going along fairly smoothly, and you can see the heart rate is fairly smooth as well. This is in dramatic contrast to this patient here. You can see the oxygen is just fine on this patient, or nearly fine. But on the heart rate is really pretty crazy. That going up and down, up and down, up and down is caused by the release of epinephrine and norepinephrine. What those are the chemicals that the body releases in the fight-flight system. Fight-flight is a very strong response. It comes from our primitive brain. It's what's protected us for thousands of years. It's what keeps us away from danger. My example I always use is if you're driving down the freeway and it's late at night and you're sleepy and nodding off and you can't stay awake, and all of a sudden a semi-truck cuts you off and you nearly get killed by being pushed into the guardrail, you have no trouble staying awake after that point. You know, you'll stay awake and be awake probably for the next hour. Well, that's all adrenaline. Well, what happens to the body is the body, if it senses it's not getting enough air or enough breath, as I say, then it releases the epinephrine. The epinephrine will cause the body to wake up, and all of a sudden you're not in deep levels of sleep. So your problems with memory, your problems with tiredness the next day are all there. But you go and you have your sleep apnea tested, and it'll say, there's no problem. If it goes back to my reports that I use all the time, just to give you an example of it, it shows that this is the patient safety software. It'll show that this is in the green, this is in the green, this is in the green, and this is in the green. It all means it's in the green, which means it's fine. This is only a 2. A 2 is less than 5, and 5 is considered to be the threshold for calling something sleep apnea. Well, prior to having sleep apnea, many people will have headaches, and that will be the condition that they come to the dentist for. The headache patient will, again, look like this. Their heart rate will be highly active. And when they're active like that, we can use the same devices that we use to treat sleep apnea for them, and many times resolve the headache. This has been shown with CPAP for several years, but it can also work with the oral appliance very, very effectively. So one of the main uses that I have for the oral appliance to treat sleep apnea is actually not to treat sleep apnea, but to treat upper airway resistance. And that tends to be in women under 60 years old, primarily small women, and you'll see it sometimes in men as well, but mostly women. Almost 11 times more women have this problem than men. So if you're a small woman and you're having headaches and you're having difficulty maintaining sleep, consider having the airway evaluated. This is what we do for people. This is just a graphic. It's an x-ray of the side of their head. This is the patient as they came in without an appliance in, and this is the patient with an appliance in. You might notice that the airway is larger here than it is here. Well, what I did is I put an appliance in and I moved the lower jaw forward. What's interesting is the patient, as they are on the left, 6 months after treatment, can now sleep through the night. They only get up once to go to the bathroom at the very most. They have dropped their blood pressure medications down from 2 and being uncontrolled hypertensives or high blood pressure down to 1, and they're feeling good. The other thing is they've had a problem with arrhythmias. The heart was beating in a strange way. And since the sleep apnea has been treated, the arrhythmia has pretty much disappeared. What did I use to do that? Well, that's this appliance, and this is what they look like. And they just fit in your mouth. They look a little strange, but they work very well. Usually people look at them and they think, well, I could never have something that big in my mouth. And what I've said to them is one, is our appliance is the smallest available of all appliances to treat sleep apnea effectively. And the other thing is once you get used to it, after about 2 weeks, you can't get by without it. I've been a general dentist, a cosmetic dentist. We've treated people and made them look beautiful, and I've always enjoyed doing that. And those patients were always very happy with me. And they would hug you and say thank you and whatever. Well, the patients that have one of these appliances don't just like you, they love you because you gave them their life back. You really made them feel better. There's several things that it does for people. One is it allows them to have a restful night's sleep, so you wake up in the morning and you feel ready to go for the next day. That's the big one. The other is you don't disturb bed partners beside you. The snoring pretty well stops. In most cases, we don't have any snoring. So there's a lot of benefits to this, but the main one is you tend to live longer if you treat sleep apnea. And I'll go into that chart here in a second. But what are the problems that sleep apnea can cause? Well, just to read my flip chart here so I get it in the right order, it can cause chronic sleepiness, it can cause stroke, it can cause heart attack, heartburn, morning headaches, depression, high blood pressure, impotence, and TMJ pain or headache. I'll go through each one of those in a little bit as we move along through this tape. But what about people who sleep next to a snorer or sleep with somebody that has sleep apnea? Mayo did a study of that quite a few years ago, and what they showed was that people who sleep next to a snorer tend to have very similar complaints to somebody who has sleep apnea, but they don't have sleep apnea. They just, because of the arousals and the person's fitful sleeping beside them and noisy sleeping, they also have aches and pains, the fibromyalgias, fatigue and daytime sleepiness, depression, memory impairment, sexual dysfunction, and weight gain. Weight gain is one of the big issues here. One of the interesting things about it is if you treat sleep apnea, most people will lose 10 to 35 pounds in the first year without really dieting. I'll talk about that in a little bit. But anyway, what are the symptoms and health risk of having sleep apnea? Well, you fall asleep during the day. That's not a good thing to have happen, especially if you're at the wheel of a car. I mean, drowsy driving, the statistics show that may actually have more impact on deaths on the highway than alcohol. There's been a lot of research done on that because alcohol puts a drowsy driver to sleep, and that may be the real issue. So drowsy driving is just something that we have not addressed as a nation that's going to need being addressed at some point because it's hurting a lot of people. It can cause memory problems. Well, if you don't get proper sleep, your memory doesn't what they call consolidate. It doesn't come back together. It doesn't get organized. Your brain overnight needs rest. It's sort of like your computer defragging itself overnight. Irritability, anger management, that's a big problem. When you see someone that has uncontrolled anger and uncontrolled emotions, that usually means that they're not sleeping well at night because that is one of the prime instances of it. That's really been something to have people come into the office because sometimes people are very angry about this or very angry about that. And I've learned a whole new understanding of those patients because once you treat the sleep apnea and get them to sleeping well, the anger really diminishes dramatically. Well, what about waking up with a morning headache? 90% of morning headaches are related to airway issues, maybe not sleep apnea, but what we call sleep disordered breathing. Another big one is reflux, GERD, LPR, laryngeal-pharyngeal reflux. It's acid coming up the esophagus. What it does is the tongue falls against the back of the throat, and I'm going to show you that in a second here, how that happens. But it falls against the back of the throat. The diaphragm doesn't know it. The diaphragm pulls, and it causes a very negative pressure inside your chest. What that does is help bring gastric juices up the esophagus and cause reflux. Well, the idea of treating the airway many times diminishes reflux dramatically. Depression is a big deal. Well, depression can be from not sleeping properly. If you don't get proper sleep overnight, it's hard to take the next day on. Weight gain is a big issue. High blood pressure is just in rampant numbers in the United States. Heart disease, stroke, sexual dysfunction, and automobile accidents. Again, remember that candle flame I stuck my finger into when we started? Well, what that is a reflex action. It's setting off the fight-flight response. Can you imagine, we've got a reflex to protect our finger from that candle flame. Well, what do you think happens to our airway? If you stop breathing in about 60 seconds, you're in trouble. The body sends out a huge message. Alert, alert, alert is what it's telling you if there's no airway. What it does, it releases a ton of adrenaline. That adrenaline is released over and over and over again every night. Well, that adrenaline is the instigator of what's called the fight-flight symptoms or syndromes. What that means is you're trying to run away. You're trying to get away. We have a hard time understanding that we're really not the modern people we think we are. We're still the hunter-gatherers from 10 to 12, 15, 20,000 years ago, and our primitive brain is still there. It's telling us we're in danger and we need to get away. Well, what do we need to do when we get away? Well, your heart rate kicks up, you dump glucose into your bloodstream to get away from that saber-toothed tiger. You don't have to worry. The reason sexual dysfunction's there, you don't need to worry about that if you're in the fight-flight mode because that's not the time for it. It's just a joke. That's the best one I've got. But the idea that you're running away from danger is really the important point here. It dumps glucose into the blood and it kicks up the heart rate. That's one of the reasons why type 2 diabetes and hypertension or high blood pressure run with sleep apnea. So, one of the interesting things though is you don't have to have sleep apnea to have a problem. Heavy snoring significantly increases the risk of arteriosclerosis. Heavy snoring vibrates the carotid artery right here in your throat, and many think that that causes plaque formation in that artery. What does plaque do? It breaks loose and it gives you a stroke. So stroke is a big problem with patients with snoring, even without sleep apnea. It's a problem with people with sleep apnea, but it's also people that snore. So how many people that you've known that had a stroke? At least 65% of those people who have had a stroke had some sort of sleep disordered breathing, either sleep apnea or just snoring. So stroke is a big deal. So what I would say is you treat your sleep apnea or you treat your airway to help prevent you from having a stroke. So I think that's important. It's not only adults that have a problem. I have a lot of kids that come in here. You have tonsils and adenoids. Tonsils and adenoids are a big deal. They diminish the size of the airway. The airway is like a hole this big going down your throat. And if you can imagine something hanging on the side of it, well, what that does is it turns the airway smaller. It decreases in size. As it decreases in size, you have to work harder to breathe. And these kids have sleep disordered breathing. And it's been shown that up to at least a third of these people are the ADHD patients. So look for tonsils and adenoids in a patient. What you want is they have an airway that's this size, and you want an airway that's this big. So you want a big airway as large as your thumb instead of this small little airway here. So that's what we want. What is this tongue thing I've been talking about? Well, if you look here, the tongue fell against the back of the throat. That's really a problem when you sleep on your back. Sleeping on your back is an issue because this tongue is just a big old hunk of meat. And it wants to fall backwards because of gravity, and it shuts off the airway. So sleeping on your back should be avoided by nearly everybody. Sleeping on your back is just bad. You should sleep on your side with a pillow up high on your head so your jaw hangs free. You'll breathe better that way. Some people even have what they call positional apnea, where they have apnea on their back, but if they lay it on their side, they have no apnea at all. So that's a good trick. I even have people sometimes wear a backpack to bed, which sounds kind of funny. You take a backpack, fill it with towels, and wear it for 30 days. And you can't get on your back with that backpack there. So it teaches you to lay on your side, and a lot of people feel dramatically better using a backpack. You might want to wonder what a normal airway looks like and what somebody with sleep apnea looks like. Well, here's an x-ray that shows that the airway is from here to here on this person. Okay, it's as big as my thumb. Now this is a reduced size picture, so it's, you got to realize that airway is pretty huge. It's almost as wide as my thumb, even though it's half the size of normal. But look at the person over here. They just barely have an airway at all. Just barely this little tiniest space going up the back of your throat. And that's all you've got to breathe through. So this person is not going to be the athlete that this person is going to be. This person can't keep air going into their body and getting oxygen to keep the motor running as well as this person can. So that's one of the reasons why some people are better athletes than others, is simply because of the size of airway and how much oxygen you can move in and out per minute. I talked about sleep. This is called a hypnogram. And what it is at first you wake up, you're awake here, and then you drop down into level 1 of sleep, down into level 2, then down into 3 and 4. 3 and 4 are sometimes combined together into just 3. But anyway, these lines here are the deep levels of sleep, this and this. And the deep levels of sleep are when the brain really rests. It consolidates. It's called delta or slow wave sleep. And you tend to have about 6 cycles over the night. That's what we call consolidated sleep. You might notice these little red marks up here. Those are REM sleep. And that REM is shorter at the beginning of the night and longer at the end of the night. REM is the Technicolor dreams. They say there's 3 states to being: awake, asleep, and REM. REM, your brain is very busy. And it's really working to keep your mind clear. The other thing you'll notice is this person woke up twice during the night. Really, you shouldn't wake up more than twice during the night. That's really max. You wake up more than that, it indicates a problem. Now let me show you what happens if someone has sleep apnea or sleep disordered breathing. This is this other chart. And if you notice, there is no delta or slow wave sleep here at all. This person has lost that ability for the brain to essentially to rest. And you notice all these little marks along the top. Those are all awakenings all the night. You really should only remember one dream, the dream you wake up with. If you remember multiple dreams over the night, you're really not sleeping well. The idea that you get up to go to the bathroom 5, 6, 7 times a night, you get up and, I don't want to be gross, but nothing comes out. That's the fight-flight system working, and it causes the bladder to contract, because if you're running away from that saber-toothed tiger again, what it does, you're lighter if you dump your urine. So you run away at a lighter, and all you got to do is outrun the guy beside you, is the old joke. So when you see all these awakenings, generally people will be getting up multiple times during the night. You control the sleep apnea, sleep disorder breathing, and this usually goes away or diminishes dramatically. Stroke is the big thing. I talked about it a little bit, but a stroke, it makes you dependent on everybody. And 65% of people, like I said before, that have a stroke had some sort of sleep disordered breathing. That was shown in 1996. That's an old study. Many other things go along with this too. Here's a list of the problems that occur with sleep apnea, or they go together. They're called comorbidities. So the comorbidity means that they occur at the same time. Drug-resistant hypertension. 80% of people with drug-resistant hypertension have sleep apnea. 80%. That means that they're on 1 or 2 medications for their high blood pressure, and it's still not controlled. Well, the interesting thing about it is the patient I showed you first had drug-resistant hypertension. With the appliance, we were able to reduce that dramatically, the amount of trouble they had sleeping at night, and the physician reduced the amount of medication they were on. Severe obesity, 77%. Congestive heart failure, 73%. Type 2 diabetes as high as 72%. Atrial fibrillation, 50%. All hypertension, 35%. Coronary artery disease, 30%. Angina, 30%. Stroke, 65%, like I said. Depression, 58%. And what's called metabolic stress syndrome is 60%. That has to do with the fibromyalgias and everything. We talk about mortality. What kills us? You know, what's the problem? Well, this study was done in 1988, and it was reported in Chest, which is a great journal. And what it showed was men, and this was done at Stanford, men under 50 who had sleep apnea. And that sleep apnea was in the moderate category. So men under 50, what's called their apnea-hypopnea index, or the number that all sleep physicians go by, is the AHI of 20. In this case, they just included the apneas because this is an old study. But anyway, an AHI, or an apnea index of 20, and basically and they were under 50 years old, men only, and out of 37 people in the study, 4 of them died. So 10% of the people in the study that had sleep apnea of any amount at all passed away. It's one of the biggest killers of men under 50. If you've known somebody that died in their sleep and they're under 50, many times it was related to sleep apnea. Let's go into another bigger study that was done. It's called the Wisconsin Cohort Study. This is my favorite one because it really has a big impact. If you look at it, these graphs move along. And let me just explain them to you. There's a red line on the top, and that says an AH index, apnea-hypopnea index, of less than 5, which means you're fairly normal. We've defined less than normal of an AHI as being normal. Those people in 18 years in this Wisconsin cohort study, 96% of them were still alive at 18 years later. So if you had an apnea index under 5, your probability of living 18 more years is 96%. If your AHI is greater than 30, which is severe, your probability of living 18 more years is 57%. 57%. it's just amazing the amount of people that this kills in the United States today. Not only causing hypertension and type 2 diabetes and other things, but it's a real, I don't know whether I should say this or not, but I'll see a man sitting there and he doesn't want it treated. And my classic question to him is, how well do you like your grandkids? Because you're not going to be around them. So the idea that you treat this is to be with your family. And my saying is, you know, these may be a little bit irritating to you in the beginning, but how much is 1,000 more days worth with your family? How much is 3 more Christmases? How much is more birthdays? All those things. Staying alive is really important to your family and to you too. And quality of life is important. If someone reduces from a drug-resistant hypertension where they're having difficulty with controlling blood pressure down to they're just taking one med and they're controlling it, they have a better quality of life. If you sleep, you have a better quality of life because anger is not as big a problem, depression's not as big a problem, and you get to lose some weight. So there's a lot of advantages to coming up with one of these. Everybody always starts off at a lower level. Sleep apnea takes a lot of years to cause a problem. So it really probably started off when you're in your teens, or maybe even before that. And it ramps up over time and keeps getting progressively worse, progressively worse, progressively worse. And unless you do something, it just gets worse. And so this is called the natural history of a generic disease. It's just any disease gets worse with time. These are the muscles that are involved. We may want to spend some time with them or not. There's a little muscle down underneath the jaw called the geniohyoid. It tightens up and keeps our airway open. You might wonder why we have sleep apnea. Well, other mammals do not have sleep apnea. We have sleep apnea because we can speak. The airway here in our throat is just a muscular tube, and we need other muscles to keep it open. In other mammals, that's held open by a bone. And with us, it is not. So these muscles tighten up and open the airway. A lot of younger people have trouble with headaches, TMJ. We make a little appliance called the anterior appliance. It's worked very well. I've taught a lot of people how to use this, and it's worked very effectively for headache. So some people, maybe 1 out of 20, has trouble with the joint itself. We use what's called the pivotal appliance for that, and that also works well. I want to come back and talk about one thing here that I didn't go over in the proper order through the flip chart. This is what we call a pulse oximeter reading. The pulse oximeter is really this little blue line going the top is the oxygen, and the green line along the bottom is your heart rate. We use a highly accurate pulse oximeter. It's called the Minolta 300i. It's the most accurate pulse oximeter available today that's for home use. It has something really special built into it. It just kind of looks like your wristwatch, and it goes on your finger, and it records you overnight. Well, that gives me these graphs to talk to you about. So let me show you a real patient. This is the way the patient came in. This is their oxygen and this is their heart rate. This is a problem because they were having trouble with palpitations. They were waking up in the middle of the night with their heart racing. It's just very hard on a patient to have their heart this active. I tell you, the heart is nothing but a big old pump. And what happens is it finally gives out. You just can't overuse anything and expect it to last as long as it would if you didn't use it. Well, this is the same woman. We put in this appliance in her. It took us about 3 months to adjust it. But if you notice, the oxygen got a lot better. These marks here and here actually are movement. That's where she rolled over. Pulse oximetry gives us crazy movements. And that's one of the reasons why pulse oximetry needs to be done with an excellent machine, or else those are not picked up. The Minolta knows that you move, so it put in an error. So I know that's an error. So really, most of these are pretty well gone. The heart rate looks incredibly more calm. This person is no longer tired. She used to sleep 10, 12 hours a day. She just couldn't get up. And now she's lost considerable amounts of weight and she feels better. So that's what we do. Hopefully we turn this patient into this patient is always my goal. I next want to talk about the reconstruction patient. The reconstruction patient, as defined by dentists, usually means that the patient requires multiple crowns, usually nearly every tooth in their mouth. Why does that happen to patients like these two here? Well, I would say a big part of the problem is they both have a tiny airway. They're both small. They both have sleep disordered breathing, and both of them have early apnea, or what we call mild sleep apnea at this point. The body tries to keep the airway open at night by clenching the teeth, grinding the teeth, or making the jaw move forward like this at night. It does something to keep the airway. This airway is just a muscular tube, and that's really all it is. The reason we have a muscular tube there instead of like an animal would have that holds it open with a bone is we speak. That's what separates us from the apes and the rest of the primates. Well, this small airway does a couple other things. It causes the body to go into what's called fight-flight mode at night. And that diminishes the saliva in somebody's mouth. And that could be one of the reasons why these two people had more decay than is considered normal. So the idea that somebody needs a full mouth reconstruction or all this complicated dentistry simply because they have a small airway, I think is entirely possible. I've gone back and checked at least 6 patients in a row, and that was true for all of them. The other thing that dentists will complain about a lot of times on these patients is they're very difficult to work with. They tend to be very demanding, they're grumpy, there are all kinds of things. I've never found that to be true, but people with small airways have problems with emotional control sometimes. It's a known fact in the literature that anger management is related to a small airway at times. So not always the case, but sometimes the case. So it tends to be a difficult patient to deal with. And I've always made a career out of taking care of patients that other dentists don't care to take care of. So I've treated a lot of this type of patient, and I enjoy it. So we've gone through the flip chart, and I hope I've talked to you a little bit more effectively and you understand sleep apnea better. This is for the dentist, but it's also for you, the consumer. Our office is located here in Columbus, Ohio. We have people come from all over the country here. We can ship these monitors almost anywhere. And feel free to contact us through our website. It's columbusdentistry.com. columbusdentistry.com. Our office phone number is 614-252-4444. We make a point to treat people well here and make you feel better tomorrow. So thank you for listening.